Vaccines Minister. Good to talk to you today, Maggie Throup. Let's just start with getting some of the facts as how they've emerged over Christmas and New Year. How many Britons are currently in self-isolation?
I'm not sure of that actual figure, but I think what's shown over Christmas is that a lot of people have caught the disease. The Omicron variant is very transmissible. But what is good news, it doesn't seem to be resulting in severe disease as some of the other variants did. So that is really good news. And obviously people were taking precautions over Christmas, and I'd like to thank them for that.
You are the Minister for Public Health. Surely you should know how many people are in self-isolation.
Well, not everybody declares that they're self-isolating. I think that's one important thing, that it's something that they do because they've tested positive or they've been in contact with somebody who's tested positive. They don't have to report that in. But I think what has been so clear over recent weeks is that the vaccine is working, and that's the best way to stop the transmission and to stop hospitalisations and for our life to get back to normal.
But in terms of how we're going to manage the NHS in coming days, in terms of how we're going to manage schools and even workplaces, how can the government do that if it doesn't know how many people are self-isolating? When we know the latest figures about positive tests, for example, but, over 1 million positive tests, that means the people that they know, the people that they live with, will also have to self-isolate, doesn't it? So we could be looking at 4 or 5 million people potentially, or even more. You just don't know.
Well, I think the important thing is that we are looking at the data all the time with regards to hospitalisations, as you say, people who have actually tested positive, and also the number of people in the high dependency units as well. I think at the moment, if you look at people who have been hospitalised, then they are going in with less severe conditions than before, and the numbers that are in hospital beds is about half what it was a year ago. And that just shows the power of the vaccine. And my message today is, if you haven't come forward for your booster yet, come forward. If you haven't had your first dose of vaccine or delayed your second dose, there's always a chance to come forward to get those life-saving vaccines. It's never too late, and that offer is always open.
Well, we'll come on to the NHS in a moment, but on the subject of vaccines, there are around 2 million booster appointments that have yet been taken. We know that a lot of booster centres were even open on Christmas Day. Is this that people are not bothering to get their booster, or have they got a booked appointment and they've then gone to a walk-in centre and got it separately? Why do you think there are so many appointments that are being missed for boosters?
I'm not sure about it's being missed, but we did open up the national booking service so people could come along and get a vaccine when they, when they book the vaccine, or the walk-in centres as well. And they were hugely, hugely popular before Christmas. And so many people took up that offer. Over 34 million people.
There are 2 million vaccine appointments available this week. You're desperate for people to get vaccines. Why are there all these appointments available?
Well, it's quite right that we have those opportunities there for people to come forward to get their booster. It'd be wrong of us if we shut down the national booking service and just expected people to go into walk-ins. So it's quite right that offer is there for people to book their vaccine, whether it's their booster dose or, as I said, their first dose or second dose. That offer is always open, and it's quite right that across the country people can make their appointment and come forward for their vaccine.
But in terms of numbers, only 100,000 were boosted yesterday, so the numbers have really declined, haven't they?
I think we've just been through 2 weekends of bank holiday, and I think that's quite clear that numbers will change as we move forward. And what was really incredible is the number of people coming forward on Christmas Day, and even on the bank holidays, we had more people coming forward on the bank holidays than other bank holidays in the past. So people have really taken the vaccine programme to heart, and it's probably the most successful vaccine programme that the NHS has ever run, and probably one of the most successful across the whole world as well. And I want to thank everybody for playing their part, whether it's the NHS, the thousands, in fact millions of volunteers that have really helped made a difference, and people coming forward to get that life-saving vaccine in such a timely way.
Nevertheless, we're seeing critical incidents at a number of hospitals. How many exactly? We think about half a dozen NHS trusts have had critical incidents because of staff shortages. How many exactly, do you know?
I think the critical incidents are announced and then they can be very short-term ones. And it's saying to the other trusts around, can we have some extra help? Can we have some mutual aid? Sometimes it's just a matter of hours that the critical incident's in place for. Other times it's longer. But it's actually reaching out to the wider NHS to say, we have got a problem in this particular area. And it is sometimes quite geographical as well. And for different reasons. It could be staff shortages. It could be other reasons. So it's quite right.
But do you know how many we're at this morning, for example? I know, as you say, it is fast moving, but, what are the latest figures from this morning?
Well, it is fast moving. That's why it'd be wrong of me to actually say a number, because quite shortly there could be another one, or another trust could actually say, no, we're back on track now and we're okay. And it's a mechanism that's been put in place in the past. And I'm sure
sorry to cut across you, but is it wrong for you to say? I mean, we wouldn't want you to mislead, but it strikes me that perhaps you just don't know.
To be honest, I haven't had an update this morning. As we know, the Lincolnshire Hospital Trust declared one yesterday, and others have declared them in the past. And I think, as I've said, it can be very short-lived, and it can be longer as well. But it's for different reasons. Sometimes it's staff shortages, sometimes it's bed capacity. It's a complete mixture, and it's quite right.
You're the Minister for Vaccines and Public Health. You're the Minister for Vaccines and Public Health. The government has put you up today to talk to us about COVID, to talk about the pressure on the NHS and to reflect on the last 12 months of the AstraZeneca vaccine. But surely in that case, you should know how many NHS trusts are in critical measures at the moment, and indeed how many people in the UK are self-isolating. They seem to be really key bits of data that the public want to know. They want to know how many people are self-isolating. They want to know if their local hospital trust is in a critical condition or not. Does the government have a handle on this?
It definitely does. And obviously there's meetings on a on a daily basis with the key people within NHS England, and there'll be an update later on that situation. But as I've said, the best thing to do to help to protect the NHS and to make sure that other major infrastructure can continue is for people to come forward for their vaccines. As you say, it's actually just a year today since the Brian Pinker had that first Oxford AstraZeneca vaccine out of clinical trials, and that's a real good milestone, and it's an amazing achievement for British research and innovation that since then over 50 million of those doses of the Oxford AstraZeneca vaccine have been put into arms in the UK, and 2.5 billion doses across the world have been administered of that particular vaccine, and it's testament to the work that's gone on within the UK.
Absolutely, and nobody wants to take away from that. But equally, we also have to look at the current situation as we have it now, not the situation over the last 12 months. And the Royal College of Nursing have called on Sajid Javid to work with counterparts across government for a more cautious approach in England. The RCN's also said it's concerned about the fact that there are different regulations in different parts of the UK nations. We're hearing about pressure on maternity departments. We know that some hospitals in the north are now not allowing visitors again. It does seem that the messaging that's coming from the health service is that the government needs to be doing more. Is the government listening? Is the government prepared to bring in more restrictions?
Look, as the Prime Minister said yesterday, that we have got Plan B, which is people working from home, the COVID pass, face coverings, and obviously the vaccine programme, which is so important. And
these are all important, but if they're not working, if we have 6 trusts in critical measures, then it suggests that the Plan B possibly isn't as effective as it might be, and that do we need to be looking at Plan C?
The Plan B is working. As you can see from the number of hospitalisations, it's far fewer than this time last year. And that's so important as well, that the vaccines are working, the measures for people to work from home are working. And people are being really compliant. It's really good news that people want to do their part to make sure that we get this virus under control. And the Prime Minister said that Plan B is working. There'll be a cabinet meeting today. And I don't see any reason why we need to change. It's important that we do follow the data. We've done that all along, and we'll continue to do that. And people are playing their part, and I want to thank them for that.
You're talking about the vaccines and how important they are. Why are we then selling off a UK vaccine development centre near Oxford, the Vaccine Manufacturing and Innovation Centre? I mean, that doesn't seem like great confidence boost, does it? That if we are selling off these facilities as soon as they appear successful?
Well, I wouldn't want to comment on the commercial decision, but I think what is important that we've got a good supply of vaccines. We've got the Pfizer, the Moderna, AstraZeneca, and others coming online as well. And it's important that people do come forward for those first vaccines and the second one as well. That offer is always open. And I think what was really encouraging as well was as the booster programme was turbocharged, more people came forward for their first dose as well. I think they've seen just how important it is. They've seen other people get the vaccine, and they've also sadly heard the people say that they've been seriously ill because they haven't had the vaccine. And to put that message out that vaccines are important, they do save people from getting serious disease, and they do save lives.
Yeah, despite that, we still have 6 trusts and critical incidents. Maggie Throup, Parliamentary Under Secretary of State for Vaccines and Public Health, thank you very much.